all learning how
All of
powerful
our
this tool
providers
can
are
be.
now
Really
using it.
90% of
We have
our
been
visits are
preventing a lot of
telemedicine.
emergency room visits.
I always like to share this story. Actually, I got to talk to a 96-year-old patient last week. Never uses the computer. I was able to walk her through how to use the patient portal, and she ended up in tears thanking us because she's like, now I don't have to come to the office. I can just call them through here.
The relationship that you have with people is so dependent on seeing them and seeing their expression and having that really personal interaction. It can be as simple as, here's my blood sugar log, holding it to the camera, or I'm asking, what is the name of that medicine that other specialist gave you? And they can just hold it up for me, and that's really comfortable for them to do.
One example of a patient was a woman in her upper 60s, was having some urinary tract symptoms as well as upper respiratory symptoms. She was extremely fearful that she may have contracted coronavirus and was afraid to leave her home. And in speaking with her and getting a good history and conversing with her and looking at her throughout the visit, I could clearly tell that she was not short of breath. I was able to order the appropriate testing for coronavirus and reassure her and give her the confidence that she needed to stay home and stay safe.
He was essentially a new patient and needed to be seen and was complaining of vomiting, diarrhea, and abdominal pain. So we quickly set him up on Helo and got him set up on a televisit. I asked him a question about, what does your vomit look like? And he says, it looks black. And I said, can I see it? And he pulled the jar in front of the camera and showed me black vomit. And I immediately knew that was blood. And I told him, you need to go to the hospital. 5 days later, he did another televisit with me, and he was in really good spirits. He looked actually really good. And he said that we saved his life because of that televisit.
I think when the dust settles, this is going to be such an important tool for busy patients, for anxious patients, for elderly patients who really do. They would just love to be able to stay at home.